Okay. Hello, Dr. Yang.
Hi, Andrea. How are you doing? A
How
long time no see. Where have you been? In Indonesia or
oh,
no?
I'm in
In Thai?
Indonesia everywhere. Yes. Yeah, I've been traveling everywhere in the world, but I stopped travel since the pandemic. And now I'm doing more works now in my country in Indonesia. And
Okay.
then I've been missing the works, what you have already done in US. And then when I was having the experience, I think back then was 10 years ago, when we are doing all this kind of like wellness things with every wellness expert in the world, and then everybody who concerned about health.
Mhm.
And
Yeah.
I'm really impressed how do you really kind of like reverse the disease using just simple the nutrition, like making a very good nutrition
Hmm.
for the body, and then helping people to aware people how important it is to just like nourish themselves, and then creating the better health for everybody. I really
Yeah.
congratulate you for your big work.
Well, thank you. Yeah. Well, I'm keeping track of you and what's going on, and I know you've been involved in patient care and lecturing around the world and learning more, always learning new things. But to answer your question about disease, I like to kind of break the word up, dis-ease rather than disease, because the dis-ease, which could be anything from enervation or irritation or inflammation or induration, ulceration, or degeneration, those are just stages of an underlining causative reaction to a pollution in our solutions. And those solutions are primarily where this begins is in the largest organ of the human body called the interstitium. And the interstitium contains a fluid called the interstitial fluids. And unfortunately, most clinics or clinicians or labs do not test these fluids, but they make up 80% of a body of fluids called the extracellular fluids. Vascular fluids are only like 20%, where interstitial fluids are 80%. But you have to look at 100% of the fluids to really know what's going on. And why it's really important when we're looking at specific diseases, there really aren't any specific diseases. They're just specific disease or disease symptomologies. And the underlying cause really is, uh, I've been focusing on the last, 4 decades on the foundational or the genesis of where disease begins, and that begins in our body fluids. The cells of all of our, I mean, we have 70 trillion cells, and the cells of our body are bathed in a fluid which is called the interstitial fluids. And these fluids, if they're not maintained at a delicate pH balance of around 7.4, if that pH begins to drop, then you end up with cellular aging and deterioration and genetic mutation, and this is not good. So, uh, unfortunately, for most practitioners around the world, and I know you know this, but they're treating symptoms like influenza. We think that's a disease, but it's really not. It's a symptom of forced expulsion of acidic waste from the interstitium. Psoriasis or eczema are just the body's release of waste to the pores of the skin coming from the interstitial fluids. And where's that fluid coming from? Well, okay, interstitial fluids become like the septic tank or the dumping area for cells. When cells are functioning, they produce waste, and that waste gets pushed out into the interstitium, which is the largest organ of the body, which contains the interstitial fluids. When there's toxins from, let's say, the food you eat, maybe it's an egg, those particulates, those nanoparticulates get into the blood from the intestines, that gets pushed out into the interstitial fluids. The body has to get rid of that. And unfortunately, for those who are not eliminating properly through urination or defecation, then it comes out through the pores of the skin. This is what causes all blemishes on the skin, from something as a pimple
That's true.
to a melanoma cancer cell. These are just stages of cellular breakdown.
Mm-hmm.
So the treatment, in order to have
Yes,
beautiful skin like you have, and to maintain that, you have to maintain the internal fluid environment to have beautiful skin. The other thing that most people don't realize, that skin is made from blood. And so the health of the blood, or the quality of the blood, determines the health of the skin. So looking at you, I can say, without even seeing your blood, I know that you're not only protecting the alkaline design of the fluids of the body, but you're also eating foods that build healthy blood. And that's really critical, very critical. So I don't know if that answered your question or not, but maybe it was a good start.
That is very good. And then it's very true. I always share with my patient also, like what you have already been sharing with us, so many years before. And it's kind of like now people are getting more realized how important the nutrition they eat every day.
Mm-hmm.
And then I started to change so many people's, how to say that, the health challenge, like from the PCOS, the irregular menstruation, and then this kind of like acne things, and then the weight gain, and then the obese people. It's just simply what a bonus, like after they start doing their alkaline diet, they combine with their own kind of like activity and so on, they just reverse their health. Even though like it's still being a challenge, like not everybody can do 100% alkaline diet, but at least they try, at least they kind of like have already make a start, and then it is really contributing a very kind of like big impact on their health. And I saw your works far like long time ago when you're doing the show with Anthony Robbins, and then it was kind of like very open. It's like open my eyes also, like people have to really look at what they eat and what they drink right now, and then what they do also in their daily life, because everything is contributing to the chronic kind of like inflammation if we are not looking after our body, and then seeing how we let ourselves being kind of like exposed to anything, can be positive or negative. Like if people, even though like if they are living a very stressful life also, it's also contributing the very acidic things, or we call it like not healthy things, to ourselves. Do you agree with that?
Exactly. So what you said is, what we eat, what we drink, what we breathe, what we think, what we feel, and what we believe all contribute to how we feel. So,
and also the handphone, the electromagnetic also.
yes, EMF from cell phones. Yeah, the electromagnetic frequencies, or do not resonate with our cells. In fact, they disturb that sympathetic resonant balance through, even though it's considered non-ionizing radiation, these waves or frequencies are very disturbing to the membranes of cells. And when those membranes are disturbed and start breaking down, they create an effect. And that effect is a crowding effect known as the corona effect, which I have taken pictures of, for over 40 years. And so the corona effect is a condition of cellular membrane breakdown, not due to a virus, but due to a polluted environment. So the solution is to clean up the pollution within your body, and rather than treat any specific disease, and move away from this whole viral type theory that, things are contagious, other than the whole etiology or the idea, which really only exists on a piece of paper, or somebody's program that they wrote out even the RT-PCR testing is a computer program. It doesn't identify anything real other than it assumes something real and then multiplies that out into something. It's created by a computer program. So the whole idea of a virus in Latin, which means poison, is not really dealing with something that's real. That's why I call HIV a phantom virus, or the novel coronavirus is a phantom virus, or Zika is a coronavirus. But what I have discovered is for every so-called virus that's creating a certain specific symptomology, there is a specific chemical compound that's poisoning the body. And that's what we need to look to. You know, if we're looking under the microscope, we can actually see the various toxins at the cellular level that is coming from, let's say, black carbon or carbonic acid, or not carbonic acid, but carbon monoxide, to titanium dioxide, to hydrogen, arsenic. And we're breathing these things into our body, and the body has to respond to that. And some of this air pollution, particularly in like, you know, cities like New York City or Los Angeles or Chicago, London, Milan, you know, not the focal point, but the epicenter of the so-called coronavirus. That particular city in China, Wuhan, is one of the most toxic. Yeah, it's one of the most toxic cities in the world. And one of their major problems is air pollution. But when you combine air pollution with radiation pollution, you have the perfect storm for getting sick. And what happens is when people are experiencing shallow breathing or loss of air, if they're experiencing a cough, this is the body gasping for oxygen. And what we're really dealing with is pulmonary embolism and disseminated intravascular coagulation or pathological blood coagulation, which is caused from the air pollution and the radiation pollution. And in fact, radiation pollution from Wi-Fi literally destroys the hemoglobin of the blood. And if the blood loses its hemoglobin, it can't pick up waste products and it can't pick up oxygen. And it becomes compromised, and cells start stacking together. So inflammation, another word for inflammation, it's a 4-letter word, it's just ACID. And if you're eating too much meat, that produces an acid called uric acid, which causes a symptom called gout. If you're eating too much dairy or too much sugar, or if you're not, or if you're over-exercising or under-exercising, metabolic acid called lactic acid is always associated, is always present in the cause of cancer. So you can't separate cancer without having high titers or high levels of lactic acid. And that's also true with citric acid. These are two major acids, citric and lactic, that cause all the different varieties of cancers in the body. And it's coming from the pollution of the fluids that surround the cell. So you need to get rid of that acid. If it doesn't, guess where it goes? It goes into the connective tissue. Oh, wait a minute. That, you know, if acid is going into the connective tissue, that causes joint pain. That causes muscle pain. That causes cramping. You know, this is not imaginary. I mean, this is real. People of all walks of life in every country around the world experience inflammation because they're not removing the metabolic or environmental or dietary or respiratory waste out through urination, perspiration, respiration, or defecation. So things are backing up.
It's very funny that you mentioned that. And then I was, I think 2 weeks ago, I was just mentioning about the metabolic waste, how they disrupt our cells balance, and then break the cells, and then causing all the failure in the organs and so on. Mm-hmm. So basically, the disruption is really true. It's like can be biological, can be from all the environment waste that we are facing, and it's also very surprising, you know, when after I learning from your class so long ago, when I get back and I'm trying people's blood to see what I can find, and then what is the difference from healthy lifestyle people or patients. Mm-hmm. I just test their blood, and then so surprising, like I was finding like people who are really looking after their health, it really show in their blood, like their life blood analysis, and also the dried blood analysis. And by accident, we have already kind of like helping quite many people to ask them to focus more on their health, because like suddenly I just come up with like, how come this person's blood is really dirty? And then it's really creating kind of like a suggestion for me to ask him and ask her to check the tumor markers. And you know what? Some of them was having the late stage of the cancer stage. It's like walking dead, but they're still alive. And then how surprising that what you have already taught many of us, like how can we see and so on, it's really need to be combined in how to say that, in our health analysis also. I mean, being a doctor, like we've been taught so many things about the system, the physiology and biochemical things, any kind of reaction in our body. Mm-hmm. And then the emphasis that we really have to look at now is like, really is what you're saying, like the pollution and so on, is if we can do something about that, it's good, but at least we can start from ourselves also.
Absolutely.
Right? And then the free radicals that we're creating from our body as a metabolic waste also, when it's too much and then it cannot be neutralized anymore by other antioxidants in our body, then it's creating the chronic inflammation, and also what we call it in the medical term is reactive oxygen species, yeah, ROS. And then this we know that it's like contributing in so many degenerative diseases.
Yeah, well, yeah, it's interesting because what happens with the innate immune system, and a lot of people don't know this, there is an organ in the body that's responsible for providing the alkalizing compounds to manage and maintain the alkaline design of the blood, the interstitial fluids, and the fluids inside the cell. And most people don't know that organ is the stomach. The stomach produces sodium bicarbonate to alkalize our food and to maintain alkalinity. And it's controlled by a special group of cells of our nervous system that is found in the brainstem, called the nucleus totalis of the ascites, which are glial brain cells. This bundle of glial brain cells, they're called astrocytes. They control homeostasis. They control the biochemistry, our body temperature, the pH, all the electrolytes that are controlled by that particular bundle of cells, grouping of cells that's found in the brain stem, not in the brain, but in the brain stem. And these astrocytes can become suppressed by an increased amount of interstitial acidity from diet and from lifestyle choices. And it can also be suppressed by wearing a mask. It can be suppressed by a head bang injury or a neck injury to the cervical spine that here again protects that brainstem. And so, you know, if things aren't functioning right, then this part of our nervous system, which controls the central nervous system, the astrocytes, it affects whether the stomach can properly provide enough sodium bicarbonate, you know, to help maintain this alkalinity. And one of the major ingredients in the stomach's production of sodium bicarbonate is salt. And it's the one thing that many people around the world have minimized in their diet, and it's life-saving. Salt is at the foundation of maintaining the alkaline design of the internal fluids of the body, and also providing these salt ions, which then transport electrons to every cell, because our body doesn't run on food, it runs on the electricity of that food. So when you're eating food, like you see behind me, you see avocados. These avocados are electron or electric donors to our bodies. Now there's oil in there, I understand, but that oil is not where the body derives its energy from. The oil is used for lubrication purposes. It can be used for building the lipid membranes of cells. But the energy, the electrical energy of that food, we eat for energy, not for taste necessarily. Of course, it's more enjoyable if the food tastes good, and avocados do taste very, very good. But you take the avocado, you add salt, you know, and here again, you can eat as many of these as you want, and they provide a source of fuel, which is in the form of an electron, that then allows the body to use that electron for life force energy. Now, when it uses that energy, it produces a waste product. Okay, that waste product is acidic. That waste product is generally a lactic acid or a uric acid, and that waste goes into the interstitial fluids. The body holds onto that acid, that poison, until it can release it into the lymphatic system to move it out through the pores of the skin or out through the kidneys, through urination. So the body's constantly trying to purify the fluids. And I think the most interesting experiment that was ever done in the history of mankind and womankind, because we're all, you know, so his name was Alexis Carrel, and Alexis Carrel received a Nobel Prize 40 years after he died.
Wow.
40 years after. So he didn't receive it while he was living, but he did an experiment in 1906. And he's known as the father of the modern day transplantation. So if you know someone who's getting a liver transplant or a kidney transplant or a heart transplant from another person who has passed on, that transplant has to be preserved. You don't move it from the body to another body. It goes into a solution. And that solution, you know, preserves it and preserves its life so it doesn't die. Well, his experiment in 1906 proved that the human body can live forever. That's why his experiment is so significant. He was able to take a heart and by every 72 hours, removing the waste and then saturating it in alkalinity, in mineral salts, he was able to keep this heart alive until he decided he had proven his point. He kept the heart alive for 20 years.
Wow.
Okay? So if you maintain the internal environment, healthy environment, the fluids of the body, if you maintain its alkaline design, the heart and the liver and the lungs and the skin and all the organs have no limit on their life other than what you believe. And belief is a limiting, as it relates to mortality, is limiting and relates to how we perceive life. Some people say, well, you're only supposed to live so long. That's a limiting belief. Some people live longer than 75 or 78 or 81. And they say, well, that person has healthy genes. No, that person has good elimination and has maintained his alkalinity and purity of his solutions that bathe every cell. Because once those solutions are compromised, cells break down and we begin to age. The aging process is a fermenting process. You see, we don't get old, we mold. And if we want to stop the molding or aging process, we have to be aware that is the solutions of our body are something that you have to care for. So how can you monitor your body fluids, particularly the interstitial fluids, so that you can maintain an eternity of life? If you don't want to limit your thinking here, you would like to live to 100 or 125 or 150, and not just surviving, but thriving. You have to understand this biological scientific principle of managing and maintaining the fluids of the body in an alkaline state at 7.365 to 7.4. So what do you do to do that? You know, I'm here in the United States. You're over there in Indonesia. There's 7.5 billion people. And how many people know that they have the potential to live as long as they want while thriving, improving the quality of their life and thriving and literally protecting themselves from sickness, disease, by just doing this simple thing? All you have to do is get some pH hydrant paper, it's called litmus paper, and you test your urine every time you urinate. And anytime the pH is below 7.8, which means it's not a dark green or a dark blue, it's actually a light green or a yellow. You can tie this to a specific number on a scale that goes from 0 to 14. Ideally, the pH of the body fluids, particularly the interstitial fluids, at 7.365. You pee on a strip in the morning. If that strip has no color, you're in a pH of about 5.5. Well, that's not good. You have to do something about it. And what you can do is take an alkalizing dose to raise the pH so you can protect the cell so it can have an infinity of lives and those anatomical elements that make up those particular cells. And you do that very simply by taking a combination of salts that the stomach produces. So this is not uncommon. All you're doing is supporting the innate immunity by taking 4 salts: sodium bicarbonate, potassium bicarbonate, a little bit of magnesium, a little bit of calcium. But the main ones are sodium, potassium bicarbonate. That's what the stomach produces. And it throws that salt, that compound, out into the blood to maintain its pH. The blood, any excess, is thrown then into the interstitial fluid. And from there, it transports back and forth between and in the cells, because the cells are throwing out waste and taking in alkalinity so they can function. The functions of the body do not happen normally if they're not in an alkaline environment. They misfire, they malfunction. But when the balanced alkalinity is there, okay, then cells function on a normal way. And so, you know, yes, you have to increase your salts. And yes, you have to supplement. That's why I created the product called 4 Salts. I did that to help people manage the fluids, just like Alexis Carrel was doing with that chicken heart that he kept alive for over 20 years until he decided, I'm not doing this anymore. I've proved my point. Cells can live forever if we manage the environment. So it's not about the cell. The cell is only as healthy as the body, the fluids it's bathed in. And when the secondary response to excess acidity is, and cells start breaking down, that's when the neutrophils, which is a white blood cell that makes up 2/3 of the secondary immune system, they come out and start picking up the what are called endotoxins, but they start picking up the cell fragments, all coming from the inside out.
Do you want to share something about the cookware, and then how those people with diabetes, hypertension, and uric acid, what they can start to help themselves at home?
Yeah, so I mentioned the pH and testing the urine. Anyone that has been diagnosed with diabetes has acidic urine. You have to raise the pH of the interstitial fluids and the blood fluids, because the urine is a product of the interstitial fluids, not the blood. So you have to change that. You have to raise the pH up to an 8.4. Now that's very unusual, because in medical school, normal ranges from like 5.5 to 7.8. But we're talking about a higher level of alkalinity to maintain a higher level of health. So diabetes is the breakdown of the red blood cells. So when you're testing the A1C and the sugars on the cells, that's like testing a banana and testing it when it's starting to get its spots. Well, what happens to a banana as it ripens? It gets really, really sweet. Okay, that's what happens to us. That's when they used to test the urine by tasting the urine to see if it was sweet. If it was sweet, of course, what that is fermentation or cellular breakdown of the cells. So how do you stop the cells from breaking down that raises the blood sugar that then causes the pseudo disease called diabetes, which is a fake disease? It's nothing more than decompensated acidosis or too much waste in my solutions that's causing cellular breakdown. And that's what raises the A1C. That's what raises the blood glucose. Glucose is not a compound for fuel for the body. Glucose is a waste product of metabolism. So you want to reduce glucose to 0. Not only in what you eat, but also in the blood levels. Now that's really impossible, because when cells are going through glycolysis, glucose is a byproduct of that. And that's the body using electrons that produces a sugar, glucose. So the body, if it's not getting rid of the glucose from the blood, it means that there's too much acid in the interstitium. So this is a circulatory problem. So any diabetic, for example, one of the symptoms of diabetes is diabetic neuropathy. What does that mean? It means cold hands, cold feet, or loss of feeling in the extremities. That's happening because of poor circulation. Why is poor circulation? Well, glucose causes cells to stick together, kind of like this down here. Okay, the cells coagulate. So how do I keep the cells from coagulating? Stop it. You think, well, stop what? Stop eating sugar. Apples, oranges, pears, bananas, mangoes, papayas. I mean, there's sugar here, sugar in the morning, it's sugar all day. Stop it. All you're doing is polluting the internal environment. You need to move to low sugar fruits like avocado, cucumber. You see? And green fruit, green vegetables. This is how you get out of diabetes. Diabetes is just too much sugar. You know what the word diabetes means? Translated? Diabetes mellitus means melting into sugar. Okay? So you don't have to be a rocket scientist. You don't have to go to medical school for 7 to 8 years to figure this out. It's really simple. If you want to get rid of diabetes, then stop it. Stop eating sugar. Stop and start alkalizing your body fluids. We're talking about a 96% reverse rate on diabetes. And it doesn't matter whether it's type 1 or type 2. Because type 2 is just onset diabetes. Type 1 is generally associated with juvenile diabetes. But we have been successful at this for over 4 decades. Diabetes is a no-brainer.
I remember you have one case with a young boy, and then he was traveling with his mom, and then from overseas, and then just went to your place for advice about the nutrition. And after, I think maybe a few days, he was starting off from the insulin that he was taking. Mm-hmm. And then the mother coming back with the report to you that the doctors perhaps saying that this probably the honeymoon period. It means like probably it's just like temporary, but then they keep kind of like doing the program that you did, and then they still get the result by maintaining the daily intake that they do. So I was really impressed by that case also, like how it's like discontinuing people from taking the medicine that they normally have to continue having it. But I don't know the case.
Well, that's not true. You don't have to continue with the medicine unless you continue with your current lifestyle. If see, Andralia, if someone is unwilling to change their diet, you can't help them. I mean, one of the premises of this program is you have to be open to change. And if you're open to change, then you can reverse any symptomology. So diabetes is a no-brainer. I mean, that's an easy thing to do. How about trying pulmonary adenocarcinoma, lung cancer, with a survival rate of less than 6 months? I just talked to Inger Hartless. She's one of many of my patients that is alive today because she had the opportunity to learn what I'm telling and what you know and what we teach our patients. And you're the queen of alkalinity, you know, in Indonesia. So, you know, if someone wants to learn about how to do this, I would say, well, Dr. Andralia, of course, she's the queen of Indonesia. She has the knowledge. I mean, not only does this woman have an MD, she has a PhD. I mean, she's highly educated, but she's also intelligent. And that means intelligence means being able to read between the lines. You know, you just don't take things because somebody said it. I mean, it has to make sense. You know, and then you have to have proof. And the proof is in the testing. So you have to test the body fluids. And a simple test, as I mentioned, is just simply, if you're at home, you know, and don't have lots of money and can't travel, just start, you know, with a simple test for diabetes or cancer. Doesn't matter what the disease is, because the treatment is the same. So if you want to reduce the inflammation and normalize the blood sugars, cut out the acids, increase alkalinity, support the innate immune system, support the stomach and its production of sodium bicarbonate, and voila. 72 hours, no more leukemia. 72 hours, no more diabetes. And this is how fast, when I say this, I'm speaking specifically at those who have just been diagnosed. So you take a type 1 diabetic in the honeymoon stage, and the blood sugars are all over the place, and they're trying to regulate it with sugar, not with sugar, but yeah, with sugar, but with insulin. And then the blood sugars are going up, they're going down, too low, too high. We want to normalize this, and you normalize it by managing the environment. You see, you don't treat the disease. This is not a pancreatic problem. This is a fluid problem. You have pollution in your solutions, and you've got to change and purify those solutions and open up the channels of elimination. Now, one thing I haven't mentioned that's very paramount to improving circulation is L-arginine, L-ornithine, and L-citrulline. Those are 2 aminos, the proteins, that help to increase microcirculation throughout the entire body.
Yes.
It's very important. Extra vitamin D, K1, magnesium chloride, resveratrol, pycnogenol. Those are all contained within a product I created called L-arginine Max. The reason I created it, because I needed something that worked, that had research behind it. And when people take that to improve circulation, it helps with elimination. It also supports the white blood cells, particularly lymphocytes, by neutralizing those so-called free radicals, which are just acids, okay? And support the immune system, but support the stomach in its innate ability, in its sodium bicarbonate production, increase hyperperfuse alkalinity in the body fluids, for anywhere from 8 to 12 weeks, and you'll see all of your symptomologies go away. And at the same time, while you're doing that, you're eating green foods, drinking green drinks, possibly even taking concentrated chlorophyll to help build your hemoglobin. And you're focusing on building healthy blood that looks like this, okay? Not like some of these other pictures. And the wonderful thing about Dr. Andralia is she's trained in all of this. She knows it. She understands it. And so with her knowledge, she can educate you rather than with some other doctor who's going to medicate you. She's going to educate you and then get you on the right track on how to change your life. Because if you're willing to change because you want to start thriving instead of surviving, then you have the queen of alkalinity in Indonesia to do that for you. And so whether it's type 1, type 2, type 3 diabetes, if it's inflammation, if it's a serious, let's say a stage 1 to stage 3 cancer, or even a stage 4 metastatic cancer that may involve lymph nodes, and may have a mass, that's involved too. We've seen it all. There isn't anything that we haven't been able, that the body hasn't been able to do, that we can support it in its effort to do that. So, it's only limited by your own thinking, your own belief system. And the reason I'm so glad to talk to you is because I know you believe this, but there's so many out there that don't understand how their bodies work. And they need to understand how they work and how simple this is. And if you give your body a break from all the acids, from the coffee, from the black tea, from the ice cream, from the corn, the peanuts, from the beef, the chicken, pork, from all the dairy products, from the vinegar. Here again, if you take those out of your diet and you start putting in live foods, green foods, and you can steam them, you can add oils to them, you can add the salts to them. They can taste good. You can add red pepper to it, cayenne pepper. You can use herbs and seasonings, absolutely. So the food can taste good. You just want to stay away from fermented foods, like, unfortunately, like soy sauce, or vinegar. These are not good for the body. But there's so much you can do to help people. And the wonderful thing about Dr. Andralia is she has the knowledge, and she's a trained microscopist too, so she can actually look at your blood and show you what it looks like. And then after you go through a treatment protocol, she can show you what it looks like after a few weeks. And you can see the improvement. And you know, the skin, I know, Andralia, you work with the skin, and the skin is the largest elimination organ of the human body. So it's susceptible to a lot of different waste coming through it, because you have 3,800 pores per square inch. These are orifices eliminating gases and fluids, and you can smell those fluids. Sometimes they don't smell very good. It's called body odor that you're smelling, but that can change to sweet, just like a baby. I mean, you know, babies smell generally sweet, but you can start smelling sweet like a baby. But you can't do that if you've got pollution in your solutions. And your skin can thrive because it only takes 30 days to change your skin. The skin is evolving every 30 days. The liver is evolving every 6 weeks. The bones every 12 weeks. So whatever the ailment is, that can be restored. So if you've got bone loss, that bone loss can be regenerated. Anyway, those are just a few of my thoughts to a lengthy answer to your question. You know, but
I think you cover everything. That's
did I cover
excellent. And then
I think you asked me about I think you asked me about diabetes, and I got carried away. But diabetes, I mean, I wrote a book on it. You know, the pH miracle for diabetes, and I did a controlled blinded study on it. But in the on type 1 diabetes, we had an 83% reversal rate. And on type 2, we had like a 98% reversal. And the percentages are impressive. But guess what? If you do this 100%, you're going to get a benefit in relationship to your commitment to the protocol. Because I have 100% certainty in the results that one will get if they begin to start focusing on what's going on in the inside. It's kind of like the ocean, and you're surrounded by ocean. The ocean fish are only as healthy as the water they swim in. So if that water becomes polluted, what are you going to do? You're going to treat the fish with some sort of antibiotic or give it a vaccine, or are you going to clean up the water?
Of course, we clean the water. Yeah.
Yeah. Okay, but not you. Generally, the conventional protocol is, hey, take this drug. That doesn't clean up the water. Here, take this vaccine. That doesn't clean up the water. In fact, in reality, what it does is just pollutes it more, because it's not focused on cleanliness. It's focused on killing this, killing that. We got to destroy the germ. We got to attack the virus. Totally wrong. There's nothing to attack. Germs are symptoms of cellular breakdown. They're not the cause of it. The cause of it, going back to the fish in the ocean, if they're sick, the water they're swimming in is polluted. You have a choice. You can't vaccinate the fish or give a drug to the fish to deal with the pollution that they're swimming in. That fish is an analogy to the human cell. If you want healthy brain cells, healthy skin cells, healthy heart cells, healthy liver cells, you can't vaccinate for that. You cannot use a concept where you use disease to treat disease. It doesn't work. It's just a temporary solution. And all you're doing is wasting time and money. If you want to cure the patient, you have to clean up the solution. So, you mentioned electromagnetic frequencies. It doesn't matter whether it's no G, 1G, 2G, 3G, 4G, 5G. All we're talking about is the force of that vibration, you know. So when we're talking about 5 gig, we're talking about 5G, we're talking about up to 30 gigahertz. We're talking about the force of that vibration, that frequency. When you get up to 300 gigahertz, I mean, and they're talking about using that type of force as a weapon. You don't have to use bullets anymore. You just have to direct an electromagnetic frequency that's targeted to an individual or a group of individuals. They're all gone. They drop over dead. That technology is here today, and it's in our stratosphere. Satellites, face recognition, targeted EMF to dissonance. You know, crowd. You don't need to use shills and guns and sticks to beat people. You just come out with the electromagnetic frequency gun and you just let it out, and people are flying everywhere. It will literally pick you up and throw you 100 feet. Yeah. So this is the reality that we're dealing with now, you know, and unfortunately the technology can be used for good or for evil. And, but if it takes away our freedom, that's not good. If it takes away our choice, that's not good. You know, if it takes away our peace, that's not good. You know, people should be free. They should be able to choose for themselves. I truly believe that it's your body, your life, and your choice. And with Dr. Andralia,
yeah,
when people come to her office for an appointment, she offers, it's an offering. It's an offering. She has offerings to help you, different protocols to help you with different challenges, but they're all directed towards cleaning up the pollution in your solutions. And now you can simply measure that by getting some pH hydrant paper and testing it. You can find out where you're at. You can test the perspiration on your skin. If you got skin problems, when someone starts sweating, you just test the pH of that. There's going to be, if they're sick, if the skin is not healthy, it's going to show up with no color at all. Well, I've probably taken too much of your time, but I'm sure glad you do you have any other questions you want to ask or we need to talk to? I mean, you can take this last part of whatever I say, and that is, you know, I don't think I know that Dr. Andralia is one of the best doctors that I know of, and I can only count about 10 or 12. She's one of the best doctors in the world, and you have her all to yourself in Indonesia, the queen of alkalinity, that can help you with just about any health challenge that you might have. Any. She has the knowledge, she has the experience, and she's been proving that year after year, and it's so wonderful to see her again. And she's, as you can tell, she's healthy and vibrant, and of course full of integrity at the same time. So that's always good.
Thank you so much, Dr. Yang. You say so many things good about me. I really appreciate it. And likewise, I really want to send my gratitude to everything that you have already shared with us, especially with me. And then that's really changed some, how to say that, my health also. I remember I did have a health challenge before, and then once I changed my diet, even though I'm not as perfect as you, when you come to the alkaline diet, you are 100% dedicated to the alkaline lifestyle.
Yeah,
it's
absolutely.
really a big Yes, it's a great things that people can see what you have already come with, and then like watching you, witnessing like how many people that I know uh, being helped by you and being still going on and still live today because of your works is really amazing. But at the end, it's just like people choice, like what you say. Like we can
Absolutely.
share with people, like perhaps this way is bring something good to us. Perhaps they can start like combining. Me, I'm not kind of like very extremist person. Like in a way, I would like asking people to do 100% when they are not ready. But if they can start like, just like 30% first, and then going to 50%, and then become 70%, and then when they start feeling like the chance in their body, and then they start feeling like how the diseases was reversed. So probably it will give them more benefit instead of the not starting at all.
Mm-hmm.
So I hope like I
No,
can
that's
also um,
it's doing it the way you explained is perfect because you can back into this. You don't have to dive into the deep end on this. You can actually put your toe in and wade in to it by doing a little bit each day and making those changes. Now, if you have a serious health
yeah,
challenge, you may not have time to just make that
yeah,
transition. But if you're not dealing with any serious health challenge, make the transition. Begin improving the quality of your life by managing the internal fluids of the body. And Dr. Andralia can test the blood, show you what it looks like, and then she can follow up and show you the improvements that are being made. She can also do a quantitative test where you do a blood chemistry and also a blood count to see if all those parameters are normalized. And then if she wants to, she can also, or the patient wants to, they can also do a testing and a recording of the pH of their urine each day and keep track of that in a diary and then show that to you in a couple of weeks. And what you'll see as they start changing their diet and as the symptoms start improving, it's in direct relationship to an increase in alkalinity of those interstitial fluids, which are presented in the urine themselves. So what the goal is to achieve an alkalinity on urine at least at the high side 8.4. But I've seen pHs up in the 9s, and but something above 8 rather than in the 5s or the 6s or the 7s. This is when true healing really takes place. And so all the tools are there in Indonesia. I wished I could travel again, but everything is kind of shut down because of this pandemic, and it's unfortunate, or fear-demic. I'm not sure what it is, but the bottom line is that we have technology such as this where we can communicate with each other and share ideas back and forth. And so I'm grateful there's somebody that I had the opportunity to meet over 10 years ago that trained and educated herself and now has that knowledge and the tools to help other people, to help people in Indonesia with their health and vitality. And she's doing that right now successfully.
thank you to you. Everything's from you too. Thank you so much.
You're welcome. Well, look, thank you again for the opportunity to share ideas back and forth. Let's do this again. Maybe there's some other questions that your patients or those who are listening would like to know, and we could cover these on another session through this zoom.com.
That would be it.
All right. Well, all the best. Have a beautiful day. And thank you for
Learn
all
a
that
lot.
you're doing. God bless you. God bless your family. and hope to see you soon someday.
God bless you and bless your family too. And you stay healthy.
All right, I will. I'm trying to stay around as long as I can. I have to. I just practice the chicken heart experiment. You know, just keep your fluids alkaline. All right.
So, bye.
Bye
So
bye.
we will.
Take care. Lots of love. Bye bye.
Bye. Thank you.